A warm welcome to you again. Leprosy, an infectious disease that causes severe disfiguring, skin sores and nerve damage in the arms, legs and skin areas around the body, has re-emerged as a global health challenge. Too many women and children affected by leprosy, also known as Hansen's disease, are victims of stereotypes, physical and verbal abuse, delays of diagnosis and lack of adequate care. This is according to UN Special Rapporteur on the elimination of discrimination against persons affected by leprosy and their family members, Alic. And she said this on Sunday as the globe marked World Leprosy Day. The day was observed to raise awareness about the disease and those affected by it. Ruth.
Yes, Jerry, January 26th marked the 67th World Leprosy Day. And in several countries in Africa, pockets of resistance to the disease still remain, like in the case of DRC, where the situation is still worrying in 9 of the 26 provinces, with more than 3,300 cases detected in 2018. The DRC is ranked 5th among more than 150 countries around the world, with nearly 3 million lepers living with mutilation or disability.
Avec des mutilations et des infirmités dans plus de 150 pays du monde.
And now we're being joined by Gisk Zip from the Leprosy Mission based in Gora, Chad. Gisk has served with the Leprosy Mission for over 25 years in that region of the country. And we'd like to thank you very much for joining us on the program this morning, Gisk. So here we go. Sunday was World Leprosy Day, and from some of the statistics rolled out, leprosy has re-emerged as a global health challenge. Can you tell us from your experience in Chad, what's the Chad story on leprosy?
In this country, the disease is there. There's about 300 or more than 300 patients per year, new patients that are being detected. But that doesn't mean that there are not more patients. We think there are much more, but people are not coming forward, or the leprosy services are not correctly functioning. So that means that there's still a backlog number of patients in the country that need to be seen for treatment and also for disability prevention. So what we need to do is to treat all the patients that are being detected straight away. And with the medication, which is a good medication, multi-therapy, we will straight away stop the transmission to other patients. Now, most people of the society will not get the disease because they have a sufficient immune system. But there is about 5% of the population that hasn't got a sufficient immune system. In that case, if they live long time with a multibacillary patient that has not been put on treatment, they may get the disease also.
There is some stigmatization of this contagious and chronic disease in our societies. What about your country? What is the situation of these lepers there?
I think that varies from one region to another. For instance, in this region where we've been working for a long time, people got used to leprosy and also to disabled people from leprosy. And actually, like in the town where we are living, leprosy-affected persons that are disabled are able to sell food and put the children in the school with other children. But this is not always the case. There are whole communities that live separately, and the children stay within their own village, they have their own school, and they're not included in society. It depends also on how much awareness about contamination, activity about contamination has been carried out. So it varies. Another problem is the stigma. If somebody is already disabled, people seem to think that they are leprosy affected, but they're not patients anymore. So this is also another area of concern and of work that we're doing to tell the population that even if you're handicapped, if you're disabled by the disease, that doesn't mean that you are a patient anymore, and we want to work towards inclusion in society.
And this is so important, and we can imagine how much work could really go into this. Jiska, what assessment of progress can you make so far in the fight against the disease in Chad and globally?
Well, to work towards eradication is very difficult. We work towards elimination. That means less than one patient per 10,000 population. But we do our best to make the population aware of this disease and that there is medication so as to get better from it and to stop transmission. If it is leprosy, we can put you on treatment so you will get better, but also you won't transmit the disease to any other person. So this is really an awareness issue, and we do this through training of health staff and aid workers that are working in health clinics. Well, we hope to have more and more government involvement in the area of training, support for supervision. Also, we want them to strive for this early detection because of disability. Because if a patient comes late and he hasn't had treatment in time, nor treatment of the complications like leprosy reaction, the patient can become disabled for life. So if the government takes more interest in this disease and also put financial effort into training and supervision, that will be a very good asset so as to have the disease one day eliminated.